point in time in the life cycle of a claim. Prepayment represents the small window of time within the overall prompt pay timeline that's between adjudication and of the claim and the payment or the denial of the claim. Just as the adjudication process is repeated for each submission of a claim, the prepayment opportunity can be repeated as well. The actual window of time to audit is variable number of days after receipt of the claim, and that number of days is variable based on a number of factors, such as line of business, state, and submission type. The window of opportunity to perform the prepay audit, especially a clinical review, can be quite small. However, with the right systems, process, and people in-house or through a strong partner, a payer can increase savings by preventing the overpayment. They can realize those savings sooner with different tactics, and they can lessen the provider abrasion and reduce administrative costs. The challenge to a successful prepayment program is having those systems, processes, and people or resources available. A workflow management system needs to both integrate data from multiple sources and interface with other systems to manage and expedite many processes at the same time. Processes like medical records request, routing, and outcome reporting. And you also need trained, certified clinical staff that can support global delivery to meet very tight turnaround times. Clinical reviews are used to identify overpayment due to overbilling. Again, I'll reference the results from our first polling question. Overbilling can be very difficult to identify and uphold without a robust clinical review and dispute process. CO finds overpayment in 4 major categories: compliance of documentation guidelines, delivery of the right level of care for the member's condition, performing services in the most appropriate and cost-effective site of service, and providing services that are not medically necessary. The challenge to a successful clinical audit is in selection of the high-risk claims. Selection is dependent on strong analytics built on those 4 profiles: the claim, payer, provider, and member. Clinical reviews are the best approach to identify overbilling, and findings may be a result of revenue maximization efforts applied by the provider.